Kirsten, hello, how are you?
I'm okay.
I looked at Ginny's X-ray and CT scan images. Unfortunately, she suffers from craniosynostosis, as we suspected. The images show that her suture has closed prematurely.
Okay.
Babies' skulls have openings called sutures. They allow the brain to grow. In the first year, the brain triples in size, and after that continues to grow until they're, about 12 years old. Can you tell me a little bit more about Jenny's symptoms?
She cries all the time. I consulted 5 or 6 doctors, but no one really helped. They said I should let her cry, that I shouldn't spoil her. But I was sure something was wrong. She's in a lot of pain.
Sorry to hear that. Jenny has the condition craniosynostosis, but her skull shape is almost normal, so it may have made it more difficult to diagnose. Craniosynostosis is uncommon, so many doctors have difficulty detecting cases like Jenny's. Just to explain a little more, as Jenny's brain is growing, it needs to be able to push the skull bones apart, giving it room to grow. If there's a fusion in the suture, then the growth is inhibited and the brain is squeezed. Intracranial pressure can be extremely painful, so I'm really impressed at how brave Jenny is. She's a strong child.
Yes, that's true. She is. So, what are the options?
Well, my greatest concern is reducing that intracranial pressure, and we can do that with surgery.
Surgery? That sounds really dangerous. My pediatrician thinks it can be fixed with a helmet.
If the sagittal suture hadn't fused, then a molding helmet might work, but not now. Every surgery has several risks, especially head surgeries. Jenny is otherwise healthy, so that greatly reduces many of the risks. We'll double check to make sure that there are no heart or lung conditions which, may undermine surgical treatment.
I'm just really concerned. What exactly will this surgery involve?
Well, you've got two options. Jenny's only 6 months old, so we can do a minimally invasive procedure, or we can go with the traditional surgery. I'll explain the difference. With the traditional approach, we make an incision at one ear. We go over the top of the head to the other ear. It's usually the only scar. It's normally hidden by the hair. Once the incision is made, we remove the affected areas of the skull, create an opening for the brain to grow. We reshape those bones, return them to a normal position, and after we're done, the incision is usually closed using dissolving sutures.
This sounds really difficult.
Well, it is. I won't lie to you. It's a big surgery. It can take up to 8 hours. After that, Jenny will have to be in the hospital for 3 days. Craniosynostosis is complex, and it requires the expertise of a number of different specialists working together.
If Jenny has this surgery, do we know that she'll be without pain afterwards?
Unfortunately, there's no guarantee that the condition will be completely gone after the surgery. Some children continue to have some pain that we can deal with medicine. In some cases, a second surgery may be necessary, but that's very unusual because the success rate is very high. It's greater than 98%. We've been performing this surgery many years very successfully.
Sorry for so many questions. I just want the best choice for my daughter. After all the bad experiences, I want to be sure. So, what about the other procedure, the minimal one?
No worries. It's very important that you ask questions. With the minimally invasive endoscopic surgery, we normally do that when the baby is young, typically younger than 6 months. We use a suture actually the suture gets opened by an endoscope, and that procedure only lasts about an hour. Jenny would have to be in the hospital for one night. She could probably go home the next day. After that, she would need to wear a helmet for about 6 months. We'd have to check it every 3 months to make sure that the sutures weren't closing early. It's a simpler procedure. It can be equally successful when the baby's very young.
Okay. Is the helmet painful?
Don't worry. The helmet is not painful. It will be custom made. The success of this procedure would depend on the consistency of the wearing of that helmet. After about 6 months, we'd know if the growth was normal. it's not normal, then we may need to perform a second surgery, and that second procedure would be the longer traditional type. Both types are complex. We have to work with a team. My team happens to include a plastic surgeon and neurologist.
This is all overwhelming. How do I decide what's best for Jenny?
I'm sure it's overwhelming. There's a lot to consider.
So you're pretty sure she needs surgery? A helmet alone won't work?
Unfortunately, no. There's been fusion that has to be corrected surgically. Plus, if you wait a month, then the simpler procedure won't be an option because Jenny will be too old for that. We typically perform endoscopies on 2 to 3 month old babies. You should consider talking to some other specialists in the field. The more information you have, the better off you'll be.
Okay.
I'll have my assistant print out a list with the contact details of my colleagues.
Thank you. This is very stressful.
I'm sure it's stressful and exhausting. Do you have family and friends to help you?
My mom.
It's good that you have your mom to talk to for some support. Any other questions I can answer?
No, this is all really helpful.
It's a lot of information, I know. Let me give you a pamphlet which has information about craniosynostosis and treatment options.
Thank you.
If there are any other questions, again, just let me know. We'll have a second appointment, address all those concerns.